Hello and hi and assalamu alaikum. So this is Maha from NCLEX Study Guide, and today we are going to talk about a very important topic which you guys will love. I have made some notes for that, so this is right there with me. So I'm going to look down and see my notes so that I won't miss anything because this is an important topic. So today we are going to talk about 6 steps for questions and strategies for determining correct answers. So I'm going to tell you the 6 steps to which you can identify, or by following which you can identify the correct answer. And they're very important steps. तो इसमें बहुत ज़्यादा आपको डीप जाने की ज़रूरत नहीं है. They're just to give you an idea कि how can you identify a correct answer from so many wrong answers, right? So अब इसमें the 6 steps are, first step is identify what the question is asking. That is a very important step. Like I have been emphasizing it a lot since what? Since the time I'm making the videos, I've been emphasizing it a lot. So step one is identify what the question is asking and what type of question is this. For example, there are types of questions. Is it a prioritization question in which they're asking you to prioritize something, right? Is it a delegation question in which they're asking you to delegate tasks to someone else? Is it a SATA question or is it a negative query? So negative query is a question जिसके अंदर they would give a negative word. For example, not. So they would say, like what could not be the, like what could not be to this patient. So this is a negative query question. So first step is that you should read your statement carefully, that what they want to ask. You should understand the statement carefully. बात टाइम ये होता है कि हम नॉट स्किप कर जाते हैं, हम नेगेटिव क्वेरी को पॉजिटिव क्वेरी ले जाते हैं, एंड दिस इज अ वेरी कॉमन मिस्टेक व्हिच आई हैव डन, व्हिच आई हैव सीन पीपल डूइंग. So this is like very, very important. So the first step is identify what the question is saying. The second step is identify the topic as it relates to the introduction, right? So you should be identifying the topic that, okay, is it from neurology? Is it from physiology? Is it from endocrinology? और लाइक आपने पूरा ना क्वेश्चन को एक्सरे कर लेना चाहिए कि व्हाट इज इट. The third step is identify keywords or clues. That is again very important. अब हर क्वेश्चन में ना उन्होंने keywords दिए होते हैं, clues दिए होते हैं that can tell you about the right answer. And sometimes we, because most of the time we miss those keywords or clues. हमें समझ ही नहीं आ रही होती कि यार what do they want to ask actually. So you should not like you should not go with the flow. You should be doing the X-ray of the question again. So identify the keywords or clues, which I will explain it with examples so that it would be more clear to you later. So in the fourth step, you're gonna apply your knowledge. You're gonna ask yourself that what you know about the topic. What is the expected outcome? What could be the expected outcome, or what are they asking you? So in the fourth step, you should apply your knowledge. और उसमें आपने खुद से ही सवाल करना होता है कि यार क्या इसमें सही हो सकता है या क्या इसमें सही जवाब हो सकता है, या जो सवाल है इसके एक्सपेक्टेड विदाउट इवन सीइंग द ऑप्शंस. सही है, पहले आपने क्वेश्चन को समझना है, फिर आपने सोचना है कि ओके व्हाट कुड बी द एक्सपेक्टेड आउटकम ऑफ इट. Like they can trust in the question. And the step 5, you would review each answer choice and then you would eliminate the wrong one. Right, this is very important. तो इसमें आपने right one choose नहीं किया ना, you would eliminate the wrong one, right? आपने अपनी सारी टेस्टिंग स्ट्रैटेजीज अप्लाई करनी है. उसमें भी आई विल लेट यू नो अबाउट द टेस्टिंग स्ट्रैटेजीज कि आपने एप्पल्स और ऑरेंजेस, लाइक आपने ऑरेंजेस को पैक करना है इन फ्रंट ऑफ सो मेनी एप्पल्स. तो आपने खैर अपनी सारी टेस्टिंग स्ट्रैटेजीज अप्लाई करनी है इन एलिमिनेटिंग द रॉन्ग आंसर्स. And in the sixth step, you would reread the questions and determine if the selected choice answer is the right one, right? So in the sixth step, you would review it. We will look at each step one by one and then I'll give you some examples for it so that you would know. Okay, for example, we have a question. The nurse is caring for a client who is 3 days post-op from an open cholecystectomy. The nurse is caring for a client who is 3 days post-op from an open cholecystectomy. The nurse assesses the client has a temperature of 102.4. The BP is 90/40. The heart rate is 120. And the client is telling you that he's having abdominal pain, 2 out of 10. Now, what is nurse's initial action? We're talking about the initial action. So now you have to identify the question. Like, is it a SATA question? Is it a negative query? Is it a prioritization question? What is it? So when you would see the question, you would think about all the question topics, all the question types, sorry, that what kind of question is it? And then you would notice in this question that the question is asking you what is nurse's initial action, initial action. So initial is the keyword or the clue which tells you that this is a prioritization question, right? Initial means that what is the priority which you would do? What would be the priority that you would think is important? Okay, so now you know that this is a prioritization question. Now, in the second step, what would you do? You would identify the topic as it relates to the question. Okay, so now you don't need to look at the answer choices right away. You would just identify the topic that what are they asking, what they want to ask you. So now you would see that the topic is related to the nurse's initial action. But about what? About what they're asking you about, the initial action. So for that, you would see that what could be the initial action? What could be the initial action? You would ask yourself. And then you would come to the point that, okay, it might be the assessment, because assessment is the initial step, which we would do in health assessment. It's assessment, and then we would go forward to the next step. So assessment is the first step. Now, in the assessment, what do the nurse do? The nurse takes the vital signs in the assessment. Vital signs are the first step of the assessment. So, okay, now you have not seen the answer choices, but this is what you're getting right now. Okay. In the third step, what you would think, you would see the keywords or clues, right? So you would see, okay, that what could be the words that can modify or focus the analysis of the topic, right? What could be those words? So in this question, this includes 3 days post-op. That is the keyword. The patient is not first day post-op, not second day post-op. He is 3 days post-op cholecystectomy. Okay, so now here you would apply your knowledge and clinical judgment with critical thinking as well. So now you would ask yourself about, okay, what do you know about vital signs, or what do you know about assessments? Or is this a normal or abnormal presentation? Is this situation an expected or unexpected outcome? Like, what could this be? Now you would ask yourself these questions. What could be the hypothesis of this, or what would be the expected outcome of this? Now you would ask yourself, and then when you would apply your knowledge in clinical judgment and everything else, you would land to a right answer choice. Right? You would eventually land to the right answer choice before even seeing the answer options. And then you would review all the scenario, like whatever the question has told you, the elevated temperature, the tachycardia, the low BP, what do they show you? What do they tell you about the patient? And he's a 3 days post-op patient. Is this a normal thing in 3 days post-op, or is this abnormal? What could be happening? What could be going on with the patient? Now you would ask this. And then you might think that elevated temperature, tachycardia, low BP. What do they give you? They might give you sepsis, right? So yeah, now you're landing to something good. You're landing to something reasonable. Okay, so it may be sepsis. Now you would read all answer choices in the fifth step carefully, and then you would decide if they fit the scenario, right? So the choices are reassess and check vital signs routinely every 4 hours, administer antibiotics as prescribed, notify the healthcare professional, or medicate the patient for pain as ordered. And now you would eliminate all the wrong ones from these 4 choices. Okay, so you would eliminate any wrong choices that you would recognize immediately. For example, the first option, which was reassess and check vital signs routinely every 4 hours. Now this is incorrect, because like your patient is in a crisis. He's in a septic shock. He's going in a septic shock. He's in severe sepsis. Now what, you would reassess him? You have not even assessed him. How would you reassess him, and how would you check his vital signs? So first option is immediately incorrect, because like he's post-op with abnormal vital signs. How could you reassess the patient every 4 hours? It's a priority. You cannot do vital signs every 4 hours. you would have to do it either 30 minutes or like for 20 after every 20 minutes. So 4 hours is the wrong option. The next option is administer antibiotics as prescribed. Now, in this option, we can hold it because it's sepsis. Yeah, we can administer antibiotics, but we will hold it for now. Okay, so the third option is notify the HCP. We will hold it as well. The fourth option is medicate the patient for pain as ordered. Now his pain is 2 out of 10. Is it a priority? Would you medicate the patient for 2 out of 10 right away? Like, is it the initial action that you would do? No. It's like a no, no. So that is again an incorrect answer. So you would eliminate these two right away, immediately. So now, and then you would use the strategy for the two options that you have hold. Notify the HCP, or the second was administer antibiotics as prescribed. And now, when you would use the strategy, you would see that, okay, what was the strategy for prioritization? Are they asking about ABC, airways, breathing, circulation? You would apply that strategy there. I have discussed the strategies in another video. So if you have not seen, there's a link over there, just go and see that. So are they asking about ABC, are they asking about Maslow hierarchy? You would try all these 2 to 3 strategies and then you would see that which is the perfect fit for this. Okay, so the poor perfusion, low BP shows the low BP shows the two remaining answer choices. Now you would have to address that which is the correct one. So now, what you would do? Would you administer antibiotics or would you notify the HCP? Just think, just do the critical thinking, apply the strategy, and think that what would you do first. So for here, you cannot administer antibiotics without notifying the physician, right? So here, the correct answer would be you would notify the HCP first, and then you would administer the antibiotics as prescribed. So because the patient is in crisis, so you would notify it first. So this is how you would apply all the 6 steps to a single question, and then you would eventually land to the correct option. And for that, you should be knowing about the strategies. Again, the strategies are very important. And उसके बारे में हम बाकी अगली वीडियो में बात करेंगे, and I'll let you know about that. But today, this is it for the 6 step question strategies which you can do to land to the right answer. And thank you so much for watching. Please like